everybody, my name is Sara Tortorici and I'm a nurse practitioner with the Surgical Weight Loss Center at Leahy Outpatient Center Danvers and Leahy Hospital in Burlington, Massachusetts. I've been with this program for 5.5 years now, and I'd like to share with you a few myths about bariatric surgery or surgical weight loss, such as gastric bypass, sleeve gastrectomy, or lap band surgeries. The first myth I'd like to share with you is a lot of people think that bariatric surgery is extremely risky, and certainly surgery comes with risk. All surgery comes with risk, but in recent years it has been found that bariatric surgery is actually safer and risk of death is much less than that of many common surgeries that you may have already undergone yourself or know others who have undergone, such as gallbladder removal or joint replacement surgeries. And in fact, long term, the risk of dying is actually greater if you have continued obesity versus if you underwent surgery. The second myth that I like to share with you is that bariatric surgery is the easy way out. I have many patients who have told me that it took them a long time to come in to see us because they felt like they were a failure. They felt like this was taking the easy way out, and they didn't want people to view them in that way. And what I will tell you is that surgery is not the easy way out. Surgery is definitely going to take some work. You have to commit to a lifestyle change and make some good positive changes with eating and exercise. We make them as realistic as possible for you and your lifestyle, and we find that if you stick with those changes long term, you have really great outcomes and you have the greatest chance at long-term meaningful weight loss. So this is not the easy way out, and we know that obesity is a very complex disease and it requires aggressive treatment, and this is the most effective. Number 3, or the final myth I'd like to share with you today, is that a lot of people think that they'll never be able to eat in a normal way ever again after surgery. They're going to have these teeny little portions. They're never going to be able to participate meaningfully in social outings with friends or at barbecues. And what I will tell you, that certainly initially after surgery is true that you really do eat very small portions and can hardly eat half a piece of chicken. But over time your stomach does heal up from surgery, and in the end you're able to eat what we would call a normal portion. 3 to 4 ounces of protein, so kind of like a deck of cards size piece of protein, a serving of fruit or vegetable, and a small amount of carbohydrate, such as a half a cup of rice. That's a very normal portion, and we teach you how to balance your meal so that it's very applicable to going out to a restaurant where you can make a healthier choice, or going to a barbecue so that you can put the appropriate portions or choices on your plate. So surgery will limit your portion, but it's not going to make it so that you can't ever eat again. Hopefully these messages or myths were helpful to hear from me. Certainly we're happy to see anybody who's interested in having bariatric surgery, and feel free to pass this along to anybody who you think might benefit from hearing some of this information from our team.